You hear about an NFL superstar getting hospitalized, and you immediately think it's a brutal on-field injury, right? But what if the thing that took him out of the game was actually a recovery treatment that was supposed to help him? Today, we're going to break down the shocking story of what happened to TJ Watt, what it tells us about the hidden risks in elite sports, and why the future of recovery goes way beyond just a needle. Wow. That right there from Dr. Ramesh Kumar, a Harvard-trained physician, just hits you. I mean, can you imagine? Your entire livelihood depends on your body, and the very thing meant to heal you is what causes the harm? It's devastating. And from a doctor's point of view, it immediately forces you to ask two questions. One, could this have been prevented? And two, are there safer, better ways to do this? And here it is, the headline that sent shockwaves through the sports world. NFL star TJ Watt, hospitalized. Not from a 300-pound lineman, but from a routine dry needling session. This one incident is a huge wake-up call and a perfect case study for what's really going on in the world of high-performance recovery. Yeah, this is every top athlete's absolute worst nightmare. And let's be clear, this isn't just about one guy's bad luck. It actually shines a massive spotlight on a much bigger issue, a hidden risk in elite recovery that a lot of athletes and trainers are completely overlooking. Dr. Kumar has a name for this. He calls it the golden hammer syndrome. You know that old saying, if all you have is a hammer, everything looks like a nail? Well, that's exactly it. When a practitioner's whole world revolves around just one tool, like a needle, they're going to use it for every single problem, whether it's the right choice or not. It's just hammering away at a symptom instead of finding the best, safest solution. And listen, this isn't just some abstract theory from a doctor. This is TJ Watt's own teammate, Patrick Queen, saying it out loud. He's straight up admitting he's scared of dry needling because he knows there's a huge difference between that and something like medical acupuncture, which has a deep scientific foundation. Even the players themselves feel the difference. So you have to be asking, how on earth does a mistake like this even happen? Well, it all comes down to the anatomy of the error, and you're about to see why a few tiny millimeters can be the difference between recovery and the emergency room. Okay, just look at this number, 10 to 20 millimeters. That is less than an inch. For a super lean muscular athlete like TJ Watt, that space can be even smaller. That is the razor-thin margin for error between hitting a muscle and literally puncturing a lung. It's what physicians call the danger zone for a reason. And this is why that tiny margin is so critical. Let's really break it down. You've got a weekend certification on one side. You learn a single mechanical technique. On the other side, you have years of Harvard Medical School training. We're talking deep 3D anatomical knowledge from working on actual human bodies. And you know what the most important lesson is? It's not just knowing how to use a tool. It's the wisdom to know when not to use it. So if jamming a needle in that area is so incredibly risky, what are the alternatives? Well, this is where things get really interesting. Let's look beyond that single hammer and into a whole toolkit of advanced, safer ways to get elite results. Instead of relying on just one tool, a truly comprehensive approach uses an entire arsenal. We're talking about things like ozone therapy, traumeal injections, a full-body light bed like the Novothor, an ozone sauna, medical acupuncture. These are cutting-edge modalities designed to work with your body's own healing systems, giving you powerful options without those terrifying risks. All right, let's zoom in on one of these so you can really see the difference. The whole idea behind dry needling is mechanical disruption. You're basically poking a muscle to irritate it and force a healing response. But what if there was a smarter, more elegant way? What if, instead of poking it, you could send a biological signal that tells your body, hey, time to repair yourself? For an athlete, the advantage here is just massive. You know how cortisone shots can actually break down your tissue over time? Well, ozone is the exact opposite. It's anabolic, meaning it actually builds tissue. It supercharges your cell's powerhouses, the mitochondria, and triggers growth factors. The bottom line, you heal faster, you heal stronger, and you get back on the field sooner. Now, let's look at something completely non-invasive. This technology is an absolute game changer for full body recovery. And yeah, it uses light, but let's be crystal clear. This is not some little red light panel you buy on Amazon. This is serious medical grade technology. What's so incredible about this is that it treats your entire body at once. It uses specific wavelengths of light to crush inflammation everywhere and fire up your cellular energy. So what does that mean for you? Insanely accelerated recovery and a real performance edge. And the best part? Zero needles, zero trauma, period. But here is where we make a huge pivot. These advanced tools, they aren't just for fixing you when you're broken. This is where we shift the conversation from simple recovery to the science of human optimization, turning athletes into superhumans. And this is the big question, isn't it? This is what separates standard care from elite-level performance. What if you're feeling good? What if you're already healthy, but you want to find a gear you didn't even know you had? Well, let's talk about a guy who did exactly that. MLB pitcher Noah Thor Syndergaard. He used these kinds of advanced therapies not just to come back from a potentially career-ending injury, but to elevate his game to a level he'd never seen before. It's the ultimate proof that the same tools that heal can also make you better than ever. And this quote from Dr. Kumar just says it all. We don't just return you to where you were, we elevate you to where you've never been. See, it's not about getting back to your old baseline. It's about creating a new, higher baseline. That's the difference between treatment and true transformation. Okay, I know what you might be thinking. This all sounds incredible, maybe even a little too good to be true, and you've probably got some questions brewing. So let's just address the biggest ones head on. And this is the number one question we hear. Look, my physical therapist does dry needling and my insurance covers it, so why on earth would I pay out of pocket to see Dr. Kumar? It's a completely fair question, and the answer gets to the very core of this entire conversation. Here's the difference in a nutshell. The insurance system is a volume model. It's designed for standardized treatments for a lot of people. LifeWellMD is a precision model. You're not just paying for a procedure. You are investing in Harvard-trained medical judgment and a customized strategy to get you elite-level results that, frankly, standard care just isn't designed to deliver. So let's just lay it all out. Side by side, standard care is about fixing what's broken, often with assistant-led sessions and standard tech. The LifeWellMD standard? It's about unlocking your full potential. It's physician-led care directly with Dr. Kumar, using world-class technology to transform you as an athlete, not just treat a symptom. It's not even the same sport. You know, when it's all said and done, it really comes down to this thought. In sports, in life, pain is pretty much inevitable. Injuries happen. But the suffering that comes with it, that's optional. And suffering because of a risky treatment that shouldn't have been used in the first place, that should never be on the table. Look, if TJ Watt's story teaches us anything, it's that you have to know all your options, and you absolutely deserve the safest and best ones. If you are an athlete, a high performer, or just anyone who refuses to settle, you owe it to yourself to find out what's truly possible. The first step is easy. Schedule a consultation with Dr. Kumar. Go to LifeWellMD.com and discover what a truly elite, personalized plan can do for you.